I'm standing here today in front of the house of Lesley Macvean in Millgrove in the beautiful Yarra Valley in Victoria. Lesley has an important and emotional story to share with us about her journey through our health system and has an enormous amount to teach us about how people experience the system and the practitioners within it. This experience has given her an enormous passion for the focus on patients that we need in our health system today. We are strongly committed to capturing patient stories and using them to bring about change. And we're very grateful that Lesley has stepped forward to provide our first patient story.
He was a truckie, a very private man, a man who had never been ill. He always saw himself as not being courageous. He was very soft-hearted, but gave the exterior of being totally in command of whatever was going on. He developed diabetes when he was 45. Unfortunately, when we went to Tasmania, we had a local doctor that he went to that told him that having a blood sugar level of around 12 or 13 was great, which really annoyed me, and it didn't matter what I said or how much I tried to encourage him to do something about it. This particular doctor said, no, everything was fine. A lot of damage was done. One Sunday morning, my husband got up to go and get the papers and couldn't get back. He found that he had 2 blood clots to the lungs. He was admitted to the hospital. 10 days later, he had a massive bleed from the bowel. I took him to the local doctor and she sent him to Calvary Hospital. The next morning, after they'd admitted him, they put a camera down and found the beginnings of bowel cancer. They operated successfully, removed the cancer, and things were going very well. 5 or 6 days later, he started to develop pain, and they put a tube down and found that there was green stuff coming back up through the tube. So they rushed him back into theatre that night and operated and found that the bowel had died 6 inches above the joint and perforated into the abdomen. He now had septicemia and he was in intensive care. He was in a coma probably for 2 or 3 weeks. During that time, we spent several nights where they didn't expect him to survive. He had 2 lung operations because of the poison had set like concrete, and the left lung was the size of a grapefruit. His kidneys failed, his toes were black. He had everything going wrong. He ended up with damage to the pituitary and the adrenal glands, and therefore he had Addison's disease, which causes short-term memory loss. It was a long road, it was very hard emotionally, but I was very lucky. My daughter flew from Victoria over to Tassie to be with us. He came home from hospital after 4 months. He was home for approximately about 6 weeks when the district nurses found a thing under his foot that wouldn't heal. And so he went back into hospital to have that debrided. But it turned out they found that the whole of the left foot was dead to the ankle. So they amputated below the knee. He was left in the shower in the hospital on his own, and he had a fall, to which they had to notify me, and I arrived and found that the surgeon wasn't here. And luckily I was able to call back in my surgeon that had operated originally, and we moved hospitals. We found that the hospital that he was in was not as good as the one where he'd been with the septicemia. After he'd been in rehab and got home and we got it all organised and healed as best we could. It took a long time for the suture line to heal. We began the prosthetics. That became a long journey. When he was able to walk properly with his prosthesis, he applied for his driver's licence again. As he was getting ready to go back to work and was doing all the OH&S stuff that he had to do, his kidneys then had shut down, and by this time he was now on dialysis. Now we realised that the farm would be too much for us, and it meant that we had to sell. So this meant that we had to find homes for all our ponies. At the time we had 11 of them. A couple of them were very old. We just kept them because we loved them. And no one wanted them, so we had to put them down. And we moved over here and found it difficult to find a home that would be suitable to move into, knowing that even though he was walking at the time, that he could end up in a wheelchair. So I needed to find a home that he could still move around in. We were very fortunate to find the home that I'm still in now. I bought him a new pair of shoes and the shoe rubbed on his right foot. So the district nurses were dressing it but didn't like the way it was going and felt that it needed something more done to it. It got worse to the point where they sent him in to the vascular unit at the hospital where they admitted him, and the infection had become too great, so they amputated those 2 toes and attached a suction pump to it. And because of the vacuum pump was left, the dressings had to be done daily. So the district nurses did them a couple of times a week. Sometimes when they were too busy to come over from the hospital, they would send a paramedic. Well, over a period of time, the pump must have stayed on too long. Where one of the incisions were, they felt they could see the bone. So they sent him back where they admitted him and amputated bones out of his foot. So he lost now the bones below those 2 toes. Now, they really still didn't know how to change bandages, look after his colostomy bag. It still meant that I had to go in and do these things every day. I found too that they're very good at their renal job, but as far as general nursing was concerned, or anything that fitted outside the pattern, they didn't know. It was the same with bandaging his stump. And I thought to myself, don't they even teach them how to bandage anymore? It became a really sore point with me that I had to go in there and do their job. I'm almost worn out at this point and wondering how in the heck we're going to survive. I approached our case manager and said surely we could get more help once he came home, because he's now in a wheelchair. The case manager told me that we could not get any more help. I found this strange. I asked her, do you get any sort of petrol allowance? Because we'd had one over in Tassie. And she said, no, you don't get one here. And I found that hard, because to have a ambulance take him from here to dialysis and home again. Cost $1,300. But yet it was okay for me to run him in and out and wait around and take him to all these appointments here, there and everywhere. I'm a non-entity. It didn't matter what happened to me. So I said to her, surely he should be reclassified. You know, things are starting to deteriorate. Now his eyesight was starting to go. His hearing was deteriorating. His general health was starting to go downhill, which meant more care for me. She said no, that he still was classified as low care. But nowhere in the system does it say, if you've got this wrong with you, plus this wrong, you equal high care. All the system says is that's low care, that's low care, that's low care, that's low care. Tough, that equals low care. The system is wrong, and it is so hard on carers. I just find it's the anger that I feel towards the system, you know, how they, for a man who's paid high taxes because he earned big money all his life, and to see him treated this way is just awful. District nurses in Tasmania just came and bought all their, dressings and whatever was needed. You never had to worry about a thing. When we came here and found that we needed the district nurses, I got in touch with the district nurse and found that they charge a fee for every visit. They also need you to pay for the dressings. And when I queried this and said, but in Tassie we never had to pay for anything, they said, well, no, that's not here. They don't have sufficient funding. I rang the hospital back and said, if you're sending him home, why haven't you sent dressings and things for him, for the district nurses? And they said to me, no, you've got to do this yourself. And I sort of got very upset and said how hard this was. The district nurses were great. They gave me as much as they could, but on the whole, we had to pay for the dressings and that, as well as all the other medication and things that he needed ourselves. I don't know whether the people who make the decisions realise that a pension doesn't go that far, and you can't claim a lot of those things on the safety net. And that's another thing that's quite horrific. After I'd been doing this probably for just over 6 years, I felt I really needed a break. I was so tired. My doctor had said to me I needed a break. He lasted in respite for 4.5 days, and he ended up in intensive care with an infection all through his body. Then they rang me and said I needed to go in and bring some stuff in for him, extra bags and things, which I did, and bandages and stuff. And I don't think they were really aware of how much care he really did need. But he was very unhappy. He wouldn't go out of his room. And he'd only been there 5 days. He'd already organised with them without telling me that if anything happened, he had do not resuscitate in place. They wanted to keep him for another 10 days so that they could administer the antibiotics, but he didn't want to stay. He wanted to go home. He was very despondent, and we talked about whether the quality of life that he was having to face. It was difficult for him. He sort of felt that he could see me wearing out, and he could see how tired and how much strength it was taking out of me and all the stress, and that worried him. And he said to me, if I wasn't such a coward, I would do everything. I'd just stop. And I said to him, it's your choice, but don't ever think you're a coward, because he said where you've been and what you've been through. Never did he whinge, never did he moan, never did he say, why did this happen to me? He just accepted it and did it. He was grateful for everything that I did. In February, he had got a bit quieter. He must have been mulling it over for quite a while. And we had the ambulance come to pick him up to take him to dialysis. And that was a funny day, because we got 2 people on the ambulance whom he felt really, really comfortable with. They weren't particularly busy that day, so they said, we'll make arrangements unless we've got to go to take you back. And they stayed with us. The specialist came in and he sat down and he looked at Ned and he said, Mr. Mack, he said, your life is crap, isn't it? And my husband looked at him and said, yep, it sure is. And he said, what do you want to do? And Ned said, I want to give up. I just want to stop. I don't want any more. And we'd already discussed it, so it was a decision that he was free to make. I understood what he was saying. I could see him deteriorating before my eyes. And when you care about somebody, the hardest thing is to stand back. We came home, and then palliative care moved in, and the district nurses were still here, and everyone was wonderful. He was okay for a week, and then about 5 days before he passed away, he sort of took to the bed and he just slipped away one night. I think that was the best way for him to go. But nobody told me it would be this painful, even though we'd had 6.5 years of all of the journey, all of the heartache, all of the trial, all of everything. No one told me that it would be so painful, nor that I would be so angry with a system that does not look after its people.
My Ned Kelly, always here. Because his real name's Gary, you see. His father called him Ned Kelly. So Ned stuck. And he was just known as Ned.
It was such a difficult journey, and there was just so many things that happened that we experienced that I felt that if I could help someone else negotiate this path and make it less stressful for them, then the journey wasn't wasted.